My name is Dr. 𝐦𝐨𝐫𝐞. I'm the Director of Surgical Oncology at CK Birla Hospital in Gurgaon. In this video, we're going to be talking about the difference between HIPEC and PIPAC. So these are two treatment options for peritoneal surface malignancies such as gastric cancer, that's stomach cancer, colorectal cancers, ovarian cancers, mesotheliomas, and some other type of tumors like appendicular tumors, pseudomyxomas, and so on. So what we have to understand is what is HIPEC and what is PIPAC. So HIPEC is hyperthermic intraperitoneal chemotherapy and PIPAC is pressurized intraperitoneal aerosol chemotherapy. So that means they're two different entities and they're often confused. So the first difference between the two is HIPEC is a very major procedure. It's a long procedure which is in combination with cytoreductive surgery. That means the entire tumor within the abdomen, the entire disease is removed, and only after that the heated chemotherapy is circulated within the abdomen for usually about 90 minutes. In PIPAC, it's a very relatively short procedure for about 30 minutes. It's a laparoscopic procedure, minimally invasive procedure, and chemotherapy is converted from the liquid form to a gaseous or aerosolized form, and this gas or aerosol sediments and permeates the entire abdominal cavity. The second difference is that the intent or the goal of treatment for HIPEC is usually curative. That means we're trying to get rid of the disease completely and cure the patient, whereas the intent or the goal of treatment in PIPAC is usually palliative. We're just trying to maybe shrink down the tumor, decrease complications, and increase the survival of a patient. Also, a difference between HIPEC and PIPAC is the skill set and the infrastructure required for performing a HIPEC is much more complex. It requires a big team and a team effort, whereas PIPAC, the requirements are not so severe. Although PIPAC does pose certain biohazards to the healthcare workers and the doctors and nurses and so on in the operation theatre. So these two entities should not be confused with each other. HIPEC has its own indications and PIPAC has its own indications, and both can be used, when used in a good way, can really benefit patients with advanced abdominal cancers. So I hope this video gives you some idea about the differences between HIPEC and PIPAC.